my video blog for you all. Today we're going to talk about dental instruments and also how the teeth are numbered and their surfaces to kind of help you guys out for your shadowing experiences and also your first year in dental school. So here's just a basic setup. These are cotton pliers. I just want you guys to know these things because sometimes the dentist will ask you for them. So you have, we'll put it on a white background, your cotton pliers, and then you have your mirror, and then you'll have, this is a double-ended probe. So this is the Williams probe, so you can see that the style of the marks is a little bit different. Some people prefer this one, some people prefer this other one, which is UNC 12. So this one has darker tally marks, and that kind of helps you determine what pocket depths there are. So I personally like this one. But the last thing is there's another probe on this end, and then on the other end there's your Explorer. This is what the dentist uses to see if there's any cavities. You'll sometimes see them pressing a little bit harder in the tooth to see if it's sticky, and that shows that there are cavities. So now we'll look at a Typodont. Sorry, this isn't the best Typodont. It's I practiced on it for many years. So anyways, so these are permanent teeth, and it does have the wisdom teeth inside, and obviously this is the mandibular, this is the maxillary, and what I want you guys to know is that for posterior teeth, the outside that's facing the cheek is called buccal. So you have your buccinator muscle on your cheek, and so that's where the buccal comes from, but it's only for posterior teeth. And let me just mention that anterior teeth are from canine forward, and then posterior teeth include your premolars and your molars. All right, so again, buccal is on this side. When you go to the anterior teeth, that's called facial. It's also called labial. Most dentists usually use facial, but either way, just know facial or labial, and then buccal. On the inside is called lingual. So lingua means tongue, and this is facing your tongue, so that's why this is called lingual. On the upper or maxillary teeth, you can also call it lingual, but you can also call it palatal. So again, the inside part, because this is your palate, so palatal. Then if we look at either maxillary or mandibular teeth, you have mesial and distal and occlusal. So posterior teeth on these surfaces that you bite onto, that you occlude onto, is called your occlusal surface. On the front, it's called your incisal surface, because incisors are also a name for the anterior teeth. So again, incisal and occlusal. Then, like I mentioned, mesial and distal. So if you look at these teeth, you have your midline. Anything that's towards the midline is called mesial, and anything that's away from the midline is distal. So distal because it's like distant from the midline. So if we look over here, just as an example, let's just choose this back tooth. This is the mesial because it's facing the midline, and then this is your distal. Now here's a little tricky one. Over here, your midline's right here, right? So this is your mesial for number 9, and this is your mesial for number 8, because they're both facing the midline. And then you have distal, distal, so on and so forth. The last thing that I want to mention is numbering the teeth. So you always start with your upper right. So over here, this is the upper right, and you can kind of envision it in your own mouth, but the upper right is number 1. So your wisdom teeth are 1, 16, 17, 32. What I like to do is kind of remember certain things and then fill in the gaps in between. So like I said, those are your wisdom teeth. You'll know that your centrals in the front on the maxillary are 8 and 9, but if you include the laterals, that's 7, 8, 9, 10. And then on the lower, you have 23 through 26. I had to think about that for a second. And then always know the canines. So canines are 6 and 11 and on the uppers, and then 22 and 27 on the lowers. Also, dentists sometimes refer to quadrants. So if I split this in half and then 4, this is quadrant 1, quadrant 2, quadrant 3, and quadrant 4. Always when a dentist tells you to like refer to the upper right molar or something, always think about the patient. Do not think about it as what is my right side, or my right side. So if they say like, look at the upper right molar, if you're facing this, you would think this is the upper right molar, but you have to think of it as the patient. So this is technically the upper right molar. And then the last thing to mention is baby teeth. So I had one teacher who taught us Apple Jacks Kmart. So baby teeth, there's 20 of them. Adult teeth, there's 32, which I hope you know and know that for your interview. But for the baby teeth, that last molar is A, then you go on the other side, that's J, and then you drop down, that's K, and then on the other side, that's T. If you guys have anything else that you want me to talk about, I'm more than happy to. I can make another video, just leave it in the comments. And I hope you're enjoying all of the blogs that me, Erin, and Amisha are providing. Thank you so much, and I look forward to the next video with you.